minutes from the last meeting. And if there are no red flags, I would take a motion to approve. Second. Motion is second. All in favor? Aye. Approved. All right, and then we have, I should assume, Kelly, are you giving the presentation this morning? Marie's giving the presentation this morning. Thank you, Marie. We have Marie with UHC, and she's going to be going over some of their website features.
Oh, this side. Thank you. Good morning. So I'm Marie Hurst with United Healthcare. I'm a field account manager, and today I'm just going to do an overview of the myuhc.com website that members have access to and the tools and resources that are there within. Maybe I turned it off. And then it's a fancy mouse. Sorry about that. So myuhc.com is a great one-stop place for employees to look at their their medical and prescription drug benefits. So it's where they can find care, they can find their in-network doctors and hospitals, review plan information, their deductibles and co-pays, contact United Healthcare customer service, access our health and wellness programs, check their claim status, and manage their prescriptions. So when a member goes to myuhc.com, this is the screen that they will first see. You can see on the left is where they can put in their username and password. Of course, there's the handy forgot username and password links. And then if they haven't registered, there's the Register Now button. They can register either using their ID card information. They don't have their ID card in front of them. They can just register using their Social Security number. Middle of the page, of course, they're looking at this and they're not signed in yet, but middle of the page does have some United Healthcare news and updates. And then there are some things they can look at on that left side of the screen, some links and tools and common questions they can have answered without having to log in from this screen. But we're going to pretend like a member has logged in. And so next we're going to see the home page. So up at the very top on all the pages, you're going to see in little tiny writing the message center and then the account settings and then some help information. And then for the presentation, we're going to go from left to right on that bar that's up there. So you can see home is highlighted, and it's that big blue bar kind of at the top of the page, and we'll look at each section of the website going from left to right one at a time. So on their home page, on the left side of the screen, it's going to have their name, their primary care doctor. There's a handy link to change their primary care doctor if they're wanting to do that from the website. They can change dependents' primary care doctors. And then there's some plan information there as well with a couple links in green for the account balances and benefit details. To the right of that's going to be a rolling screen that just is going to go over some features that we're rolling out or that have been rolled out or that we're promoting, such as Rally, which is the wellness website. And I'll have some more details about Rally later in the presentation. And then to the right of that in the nice big boxes are just common tasks that are helpful and that members most use, such as printing an ID card. And in the bottom, you're going to see there's an information center. There are some related United Healthcare website links, and there's a chat with the nurse function in the bottom right-hand corner. So members have 24/7 access to chat with the nurse. They can chat online. There is an 800 number they can call. That 800 number is also listed on the back of the members' ID cards. So of course, not everyone utilizes the website. We love for them to, though, but they're able to find that on their ID card if they need to talk to a nurse. There are also certified counselors available through that number as well that can get them set up with some free face-to-face visits here locally if that's something they're needed. So a nice employee assistance program. And there is a Spanish, sorry, I forgot to mention this in the top right at the section, they can switch to a Spanish version of the website. So moving on, I'm going to the claims and accounts section. You can see it's highlighted in white now. So on the left side are going to be the claims and accounts links, such as account balances, where members can check their deductible and out-of-pocket balances for themselves and for employees. They can also look at a claim summary, and that's in the middle of the page. We're looking at an example of the claim summary. Members are able to filter this by date, by family member, and by type of claim, so medical or prescription. They're able to look at the details of those claims. They can go in and look at their explanation of benefit. Of course, those get mailed or emailed depending on the member's preference, but sometimes we lose those or misplace those, and you can go out to the website and you can pull those and print those. Always important for a member to compare those to the bill they're getting to their provider, so we know the provider is charging them the right amount, and if not, they can reach out to the provider for that. Let's see, next we're going to look at the physician and facilities tab. So again, on the left side of the screen, there's some quick searches and tools and information. And then always in the middle of the screen up top is where they're going to find access to virtual visits. Virtual visits are where members have 24/7 access to a virtual doctor. I'm going to have some more information about that at the end of the presentation, but a nice benefit for them. And then in the bottom middle, in the nice gray and blue colorful boxes that says, hey, look at me. There's a Find a Provider link where they can search for their in-network primary care doctors, hospital specialists, those types of things, and also a separate link for finding mental health or substance abuse facilities and providers. So I wanted to show an example of what that Find a Provider link looks like. So when a member clicks on the Find a Provider link, this is going to pop up for them, and they can do a quick search by name, zip code. They can also search by facility, by type of specialty, by condition. There are filters available to help narrow down your search. So distance, services offered, the hospital association for that provider, gender. I know that's important for my family. My daughter prefers female, so you can kind of narrow it down. You can narrow it down by language as well. And then members can see patient reviews for those doctors and facilities, which is really nice, so they can kind of get feedback from other members who have been there. And then next, we're going to look at the, pharmacy and prescriptions page. So again, on the left, a guide through the website where they can manage prescriptions, look at their pharmacy benefits and some other tools and benefits. In the middle of the page, there are going to be links for viewing their account, mail order prescription, drug pricing, and then the formulary. Those are going to pop up onto the Optum Rx website because Optum Rx is the prescription drug provider. On the left side, you're going to see some common and general questions. Hey, you're here. Maybe you also wanted to know about this because you're looking at prescription drugs. The bottom, there are some pharmacy links for locating in a network pharmacy. Always important to stay in network. So we're going to now look at what a member sees when they click one of those manage my prescriptions, look for a drug price on the Optum Rx website. So this is what a member sees when they click on one of those links and it opens up the Optum Rx website. One really nice thing is that it automatically logs the member into the website, so it knows who they are, what plan they're on, their prescription drug costs, which is important because they're looking for information for prescription drugs. So this allows for them to look for costs for drugs, pricing for the drugs. Maybe they want to look for they can look at those lower cost alternatives for those prescriptions, get basic drug information. There is an example for amoxicillin right there on the right side. And don't worry if you don't know how to spell something like me, because prescription names are really hard and difficult. Once you start typing something in that search box, it'll give you a recommendation as long as you're, close enough, just like on spell check, right? And then members can manage their mail order prescriptions from here as well. Just as a reminder, members can save a copay, so they can get a 90-day supply for those mail order prescriptions for just the price of 2 copays. So just to note the cost of the prescription drugs real quick. There are 3 tiers on the plan. For a tier 1 drug, which are typically going to be your generic drugs, it's a $15 copay for a monthly supply, or for a 3-month supply, if eligible for mail order, it's only $30. So instead of $45, they're saving $15 by doing mail order. A tier 2 drug, which is typically brand name, it's going to be a $30 copay for a month's supply, or $60 for a 3-month supply. And then tier 3 drugs, which are those specialty drugs, it's a $65 copay for a month, or $130 for 90 days. So huge savings there on that 3rd tier if it's mail order eligible.
Marie, if someone is searching for a drug to see if it is on the plan, will it show up, and then how will that look? Will it show up and say that it's not covered, or will it just not show up?
Yep, so it's going to show up. So there's an example right there of amoxicillin, which is covered. If it's not covered, it will show the full cost of the drug. It won't show the copay amount. And then also, it'll also note if something's needed, such as a prior authorization or step therapy or those types of things. And of course, you as a member may not know what that means. There's a link on explaining what is a prior authorization, what is step therapy. And then they can, if it's not covered, there's a handy alternatives tab where they can look at the alternatives that are covered that may have, like, there are 5 drugs that may have the exact same active ingredient, only 2 are on the formulary and 3 aren't. They'll be able to look at that. And they can open this up from the Health for Me app, which is our mobile app, and they can pull this list up when talking to their doctor about prescriptions, or just go to the mobile site. The mobile site's user-friendly as well. So let's see. We'll move on. Looking at the benefits and coverages tab. So again, on the left, you're going to see some medical benefits and coverage information and tools. In the middle of the page, really important for them to know the most copays that are going to be utilized on their plan, their primary care and specialist office visit copay, their hospital copay, emergency room copay, and then down below that are quick links to most commonly searched items that members look for. Next, we're going to look at, I'm going backwards. Their personal health record and the health and wellness tab. I have them both highlighted. The personal health record and the health and wellness tab go together. They both kind of direct a member to Rally, which is our wellness website. The personal health record used to be housed on myuhc.com. It's now moved over to the Rally website. So when they click on that, they're redirected to Rally. You can see my little screenshot right there. And that's where they can put in their family history, any test results or current, things that they want to enter manually. It does provide a nice little printout that they can print and take in. If they're seeing a new specialist or something, they can take that in, get a nice little summary, because they're going to ask all those questions when you go to a new doctor. So on the health and wellness tab, which is what we're looking at here, members will have access to the health and wellness tools, which are pretty much all housed on the Rally website, but there are some other things such as mental health and substance abuse, preventive care guidelines, so those things members should be getting done that don't cost them anything, right? Flu shots that are covered at 100%, flu shots, annual wellness exams, those types of things, and then discounts that members have available to them. In the middle of the page, there's a nice little rolling promotional screen that will go over things that we're promoting. One feature that you'll currently see on there is our information for our Healthy Pregnancy app, which is part of our maternity support program. So the Healthy Pregnancy app, it's won a couple of awards. We're really excited about that. We've gotten a lot of positive feedback. But members are able to track their pregnancy, do all those cool things. What is my body doing this week? What is the baby doing this week? But it also ties into their benefits. So there's nurse support, there's benefit support, so there's guidance on how to get things like the free breast pump that you can get through your health plan. And if you are a member and you download the app and you're playing around on it, you will get a phone call from a nurse, as we in our office found out, whether you're really pregnant or not. So there is actual outreach to members through that app. So really nice feature. And then when we have features like that roll out to members, they'll see that on this page or on that first home page. We'll have rolling screenshots for that too. So let's take a look at Rally. So when a member first goes to the Rally website, they will need to create a username and password and log in, and it can be the same as their Myuhc. And they only have to do that one time. After that, when they click from Myuhc to go to Rally, it just magically knows who they are and logs them in. So still just remembering one username and password. But Rally does have a separate app that they can log into, and you'll see the benefits of having a separate app in just a second. So on the Rally Health and Wellness website, members access it. We saw through the myuhc.com website there were several links. On the Health for Me app, there will be information and links. So when a member first goes to Rally, they'll take a health survey, and it'll give them their Rally age, which could be higher or lower than their real age, depending on how honestly they answered those questions, about their lifestyle. And then it's going to recommend some online missions for them to take to lower that Rally age. So things like eating healthier, taking so many steps a day, thinking a happy thought every day. There's also smoking cessation missions. So some good missions on there geared towards getting them to a healthier lifestyle. There are online communities and challenges. And while members are doing the challenges, the missions, they earn coins that can in turn be used to enter raffles to win some cool prizes. So Fitbits, Apple Watches, we've given away some vacations. I have had several people here in the city area win prizes. No one from the city yet. So hopefully members will get excited about the potential to earn some rewards and go out there and play around with that, and would love to see some city employees' names pop up on my winners list. And also there's a Rally app, which will help them track those missions because it syncs to their fitness trackers, like the Fitbits and Apple Watches and Garmins and things like that, so they can help track their exercise. So in the last item that I just wanted to review real quick are our virtual visits. Most importantly, members need to know when to use a virtual visit. So virtual visits are appropriate when you have for minor things going on, allergies, bronchitis, you got a fever, think you might have the flu, think your kiddo might have pink eye, those yucky sinus infections that we all get twice a year here in Oklahoma. When is a virtual visit not appropriate? Not for an emergency, not for a sprain or strain or something that's going to need a test or an x-ray or something like that. If it's apparent that it's an emergency, of course the doctor is going to end the call, the virtual doctor will end the call, recommend they go to urgent care, emergency room, and they actually will get a refund for that visit. They won't be charged for that visit. So just in case they think a doctor can fix a broken leg or something, a virtual doctor. So a little more about virtual visits. Since it's virtual, members have access to it 24/7. They have access to it from their phone, from a tablet, from a computer. We do have two providers, Doc On Demand and MWell, both great providers. I couldn't recommend one over the other. They do have their own separate apps that members can download, go ahead and put their insurance information on there, get it on their phone. That way when they're not feeling well, they have a provider app on their phone and they can get to it quickly. Visits usually take less than 20 minutes. The virtual doctors can prescribe prescriptions. So, those things that might need antibiotics, drops for the pink eye, they can send those over to a local pharmacy. Could really come in handy. This is the time of year where we like to take vacations and things and have fun. But sometimes kiddos do get pink eye or they do get poison ivy, and they might need to see a virtual doctor to then get a prescription to a local and network pharmacy, if they're in Dallas or wherever they're traveling. So really nice to keep in mind for that. And it's not to be used for ongoing conditions, right? So chronic illnesses, members want to go to their primary care doctor. But for minor illnesses that come up, and they don't have to sit around a waiting room with a bunch of other sick people. So that is the last item on my presentation, but thank you all so much. Any questions for me? Yes.
Is there a live chat with customer service?
Yes. Yes, so you'll want nurse for something, medical symptoms or something going on. But if you're having an issue with website or a claim or something, you're going to want to click to chat with customer service, which at the very beginning on the home page, those 3 tabs at the top, there's a contact us. That'll pop up. And then I think in most of the screenshots it's cut off, but down at the very, very bottom, there's going to be a customer service link as well. Good question.
I know a lot of people don't like calls.
I'm one of those. Yeah, if you can figure it out by yourself or just sit there and multitask, chat while you're working on something else, right?
Marie, on the virtual visits, I haven't tried that yet. So with the copay, for example, is all that handled through the app? Do you have to attach a credit card or something like that?
Yes, everything's handled through the app, and I'm sorry I forgot to mention this. The virtual visit's a $25 copay. And when so you'll register, you'll choose one of the two providers, you'll register, so you'll put in your insurance information, and then it'll ask for credit card information, or you can, a flexible spending account card member can put that in too. Yep, good question.
Awesome. Thank you
Any
so
others?
much.
All right, thank you.
All right, we will change gears and go to agenda item 4, information from employee benefits. I just want to use this as a placeholder to put out some information before we get started with the reporting from the individual policies. One is we currently have the RFP for the employee medical center out as we speak. In fact, we've already received 2 proposals back. We have a selection committee that's comprised of a member from risk management, from the budget office, from personnel, and then we have also representation from the FOP and AFSCME on our group. We're expecting to evaluate that for the remainder of the month, and then we will have vendor presentations early July and should have a selection sometime thereafter. We plan to negotiate it for a couple of months, and then we will implement with either the current vendor, which is one of the proposers, or the new vendor, starting on January 1st. So more information to come on that, but I wanted to let you know that was going on. Another thing that's going on is we're evaluating adding a 3rd plan option. We were trying to be a little aggressive with it and get it in place for next calendar year, and that just wasn't possible as we started to have discussions about it. But the expectations is we're going to roll that out for RFP early February and hopefully have plenty of time to evaluate, get it in place moving forward for the, what will that be, 2021 plan year? Yeah, so the feedback that we're getting from the members is that we have 2 very rich plans, which they love, but that if they're looking for a value option, there is no option for them. So for our folks that aren't heavy utilizers, they're still purchasing Cadillac plans. What that'll look like, I have no idea.
So it's more premium driven for the consumer?
Yes, it would.
You're more worried about the monthly expense rather than...
Exactly. I mean, the thing is that, we have employees that are running anywhere from $30,000 a year to 6 figures a year. And the issue is that we're trying to offer all of those individuals a Cadillac plan. And, for a lot of our folks, they just don't want to spend that much per month on their plan. So, all right. Moving on, I'm going to jump into the group indemnity plan reporting. And as I'm looking through the numbers here, I give my standard disclaimer when we're looking at the first quarter that, we're working our way through our members' deductibles. So, it's hard to get a sense of really what's happening. I am encouraged as we look at the first 4 months of this year versus last year, though. We're running a little bit lower on average, about $1,100 versus $1,300 from prior year. So that's promising, but, what does it mean at this point? It's too soon to say. I will just call out that this is our 2nd year of being with Prime as our pharmacy benefits manager, and that seems to have had a significant impact. We've just recently received some renewal information from Blue Cross Blue Shield, and so I can go ahead and tell you, I'm going to skip ahead, but we are looking at a flat renewal for all of our Blue Cross Blue Shield plans for actives and as well as our retirees. So that's good news. We'll have, let me put my other disclaimer on that. That has not been signed by council yet, so take it for what it's worth, although we are putting out in a public meeting here. Moving on, Looking at the group indemnity plan for our non-Medicare retirees, it's a little bit concerning. We're running a little bit hotter in our $250 deductible on that top chart there, to the tune of about $500 per member. But the population size is so small with this one, it's really hard to say, what that means in the long term. I think we've shed quite a few members off this plan. And then for our $750 deductible, I'm running fairly consistent with last year, so nothing to call out there. On our group indemnity plan for our Medicare retirees, the only thing I'll call out is that we noticed some interesting movement on our alternate plan, that second chart there for $750 deductible. With our enrollment, we've got some wild swings in membership from 96 to 126 to 105. I don't have an answer for you this morning, but we're going to investigate that and bring that back to you. So I can't really make sense of what's happening there. So we'll work with Blue Cross Blue Shield to figure out what's happening and come back to you with that. Okay, and then I'm going to use the HMO chart as a bullet for talking about renewals with them. Once again, we don't have anything signed yet, but we're looking at somewhere between a 3% and 4.3% renewal on our UHC HMO, which would be for our actives and early retirees. So I think that's pretty good numbers. We will have better information on that as we move throughout the year, and of course we'll bring that back to you. One of the things that's impacting that is we're evaluating our emergency room utilization. So in our year-end reporting, we had a significant number of people that are using the ER for what appears to be not always emergent situations. So the consideration is whether or not we change the copay. I will say that I'm blanking this morning at our current copay. Jason, what is our emergency room copay? Is it 50? Thank you. It's $50. I can tell you from feedback from UHC that is way, 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 way low. In fact, if you want to think about it this way, there is no penalty for waiting until after urgent care is closed, going in, and hey, it's $50, who cares? Of course, those costs are significantly higher for the plan, and we've had some people that have been, we'll say, they've been heavy utilizers of that benefit option. So we're looking at anything from the current renewal at $50 all the way up to a few $100s for an emergency room visit. The only other thing I'll call out here is we have not received our Medicare Advantage plan information yet. We're expecting to receive that at the end of the month, and so we'll put that out as soon as we have it. So we're not sure what that renewal rate is going to look like, although I would expect to see a few percentage points simply because we've had that ongoing insurance funding fee that's appeared one year, disappeared the next year, according to what the feds want to do. I would expect just if the cycle continues that it will show up again this year, but we'll see how that looks. So a few percentage points on that alone. Yes, ma'am. Do that top button. Yeah.
Can you hear me? Okay. Yeah. Wow. Okay, so the discussion about the ER visits, if you were to increase that, is that enough to kind of temper that growth rate a little bit?
Yeah, so to give you some sense of it, if we were to bump that to, say, $250, for example, which is hefty, it would move that number from a 4.3% renewal down to a 3% renewal.
Okay.
So for the vast majority of our members, that would be a benefit because most of us aren't going to the emergency room all the time, but it would be impactful on some individuals who use it more often. Donna, you look like you got a question. Yes, ma'am.
People that use it more often, could there be some type of, you have 3 visits at this cost, if you exceed 3, you go up to the next, and then you go up to the next, because there are people that are legitimately ill, and they're not necessarily waiting until after the clinic is closed, and they want to go to the ER. Why penalize them? Because you have a lot of other people that are misusing the system. I think that if you automatically increase it to possibly $250, then you're penalizing those people that are genuinely using it legitimately. So if there's something you could do about that, because yes, there are people that do wait until everybody's home and then they take the whole family up there, and it is misuse. But my concern is with the retirees, they don't have $250 to go because some medicine has been a reaction or something along that line. They've fallen and busted themselves up. Why make them pay that higher cost if they're not a misuser of the system?
Yeah, I agree with your point. I don't know if that model exists. I've never heard of it.
Check on it, but also this is for what you're talking about, I believe the active plan, retiree.
That's true, although it would cover our early retirees, right. I will say this, I mean, in my mind, I look at it kind of the opposite way. I feel like in some ways we're penalizing everyone who's not using the emergency room for those individuals who are using it more often. There are legitimate cases of that, of course, but hopefully that's rare. I mean, my family's been a utilizer of the emergency room in the last year, but once again, hopefully we won't see that again for another year, but I know every family situation is different.
So the other thing I think to consider, if I'm not mistaken, any copay goes towards max out of pocket, right? So you're not losing the payment against your annual healthcare cost. It's kind of how you get to that last number where you're at 100%. And so in a roundabout way, what you're trying to do is create a little steerage to have people go in a different direction to hit that max out of pocket. If somebody has a legitimate need and they go into the ER and then there's hospitalization, they're probably going to get to that max out of pocket quicker than somebody that's just nipping at it. So I guess what I'm saying is, regardless of where that number's set, you still have the same aggregate numbers, the same max out of pocket that you have to attain. It's just whether you're going this path or that path or that path. And so it is meant to create proper utilization, because $50 is extremely low in the marketplace. I mean, I would argue that $300-400 is pretty much the norm now. And so it's not to penalize, but just remember, all dollars spent for an insured under the plan all go towards that max out of pocket. So whether they spend it on this benefit or that benefit, a number of times it's still heading towards the same point.
Yeah.
So I kind of view it a little bit differently in that regard, because it is driven individually by utilization. Some people never get near the max. Some people never get near the deductible. I mean, I'm one of those people you have to drag me into don't have any utilization. Not that I'm afraid of doctors, but I just don't like to go. But other people have high utilization, and they're going to hit it much quicker.
Mm-hmm.
But it's the same number. It's just how you're. So see, I view it differently. I view it that it would just correct utilization for that benefit, not penalize somebody that has a legitimate need.
Well, and to your point, I don't know, I'm sorry I keep putting you on the spot, Kelly Marie, I appreciate you guys being here. In the circumstance where an individual comes in and they do have an emergent situation and they're admitted, it seems like our copay for inpatient is something like $100. So that's my question. So if you came in and you had an emergent situation and then you were admitted, would you pay the $250 or the $100, or how would that work? Okay, so if you were admitted, you would pay the $100 inpatient copay, not the $250 emergent copay. Okay.
And an inpatient is after 24 hours, right? So if you're in a hold, an observation, then it flips back to, if you get out at 23 hours, it's the ER copay.
Right, it depends how it's billed, and as long as you become inpatient, then that's what it's going to be.
I'm sorry.
Yeah, I was having a hard time hearing you too, so, but as long as, it depends on how it's billed, and as long as it becomes an inpatient bill, then the inpatient copay is going to apply. If it stays as an ER bill, then the ER copay is going to apply. Sometimes that's 2 hours, sometimes
There's
that's
other
24
variables
hours.
involved that trigger
Yeah, yeah.
You know, and if it's a occasional visit and you only go maybe once or twice a year, that's a big impact before you get to that deductible. I understand you're saying that it's all coming to that deductible, but if you have to get to that deductible in the first 3 months, it's a big impact those first 3 months to pay all the things you have to pay, your doctor visits and everything to get to that deductible. That's where I'm going.
No, and it's true, but in the balance, I think, we'll talk about it for a minute, is you're trying to contain cost at the same time. So you know things that's significant. You say, well, it's a 1% reduction. If you then build that into your base year after year after year, you're either on the trajectory for expense to the insurance premium, or you're trying to level that out a little bit. Because that 1% is built in. If you go back 10 years and say, well, that was just 2%, that was just 3%, all of a sudden you look and you're 34% higher. And then that's your base. Now you're either offsetting with benefits or you're charging your insurance. So I don't know at some point where the insurance standpoint is, and it sounds like they're there where they want that third plan, where they say, I can't afford it anymore regardless of what the copay is. So it's this weird balance that you have to strike between benefit selection and premium expense. And somewhere there's like this fine tipping point. And you can get into very fine details about the plan on each benefit increment level. I think typically, though, if a plan identifies an area where there's a specific concern, not on all copays for all types of procedures and visits, but you kind of start to zero in that you have an issue, then I think somehow you have to address that, or else your premium is going to continue to be built in on the base. And at some point, then the insurance is screaming. They're already probably screaming that they can't afford it.
That's true.
So
Well,
I just think about it differently. To me, it's like a jigsaw puzzle.
right.
And you're just trying to put the pieces together where the picture looks right for everybody. And there's no right or wrong answer, quite frankly. It's just the nature of the product. And it's the nature of the industry right now that you have to figure out a way to get your pieces together where some people are severely negatively impacted, but it works for the general population. And I don't know what the right answer is. I'm sure you guys can run some scenarios for them. And even probably go back and measure that against utilization to see how many people might have been affected at different levels. I don't know if that's possible or not. Like, had it been $300 last year, how many people would have incurred the additional expense? And maybe that's the way to really look at it and say, how, I don't know if you can run risk matrix or not.
I would think it'd be hard to measure that, because if it was $300, I would think twice about going. I mean.
Yeah, there's a behavioral component. Yeah, yeah.
But,
Well-
and I don't know, but I'm sure you can give some guidance.
And we've recently provided some review, and then whatever requests we get, we'll certainly submit them and see what else we can bring.
But to Donna's point, I think it is always a balancing act, as you said, with impact to the member. I will say this, part of the analysis too is what the member's paying out of pocket in the first place. And so if we run the savings of, say, 1.3% or from 4.3 down to 3, just in what the member's paying out of pocket, especially on a family plan, they're going to build up an emergency room copay pretty quick, at least within a year. I would say that's very back of the envelope, so don't hold me to that. But it's going to add up very quickly. And back to your point, every year it builds on that. So
Once it's embedded, it's embedded.
yeah.
You
But
don't take it out.
yeah, but your point's well taken. So to be continued. We'll continue the discussion. I appreciate that. It's a really good discussion on it. I don't have anything additional to call out in the reporting other than I did want to use the Blue Cross Blue Shield dental reporting to just call out that that renewal is also flat. So we're not expecting any increase for our retirees or our employees for next year. And that's it. Anything from the committee? All right. Anything from the audience? All right. Well, that's it. I would take a motion to adjourn. Will you second? Oh, fair enough. Well, all in favor? Aye. All right, we are adjourned. Thank y'all.